Greetings. My name is Heather Forgione, Program Manager for the Lankenau Heart Institute's Women's Heart Initiative, part of Mainline Health. Today's webinar is on exercise in the heart. I would like to introduce Andrew, an exercise physiologist working with cardiac and pulmonary patients at Mainline Health's Wellness Center. Andrew currently treats patients that are recovering from heart and lung procedures. He is responsible for developing and overseeing workout programs for patients and educating them on healthy living and wellness. He recently graduated from Westchester University with exercise science with a master's degree. So thank you, Andrew, for this presentation today, and you can take it away.
All right, great. Thank you for having me, Heather. So I'm just going to do a quick screen share here, and I'll start this presentation. Okay, so as Heather said, my name is Andrew Schlosser. I'm an exercise physiologist at Mainline Health, and I work with cardiac and pulmonary patients at the Wellness Center in Newtown Square. And today I'm going to talk a little bit about the importance of exercise for cardiac rehab and pulmonary patients. So today we're going to discuss the benefits of doing aerobic exercise. We'll then move into talking about the FIT principle of how to progress exercise. We'll talk about warm-ups and cool-downs before and after an exercise session. I'll also talk about isometric exercise and strength training. And then we'll finish up by talking about how to properly and safely exercise in certain weather conditions. Then we'll go over some tips on overexertion and overtraining, and then we'll talk about just general wellness to finish up the presentation. So, aerobic exercise is defined as moving for several minutes or longer using large muscle groups, such as the leg muscles. When you do this, it increases heart rate and also the rate of breathing. Aerobic exercise is also known as cardiovascular exercise, or for short, cardio. And it's, of course, very important to helping you stay healthy and prevent diseases. So let's get into some of the benefits of aerobic exercise. It makes your heart and lungs stronger. And the way this works is when you exercise, your heart rate increases. So therefore, your heart becomes stronger at pumping blood. And also, the blood can move more efficiently throughout your body. So therefore, when at rest, your heart rate can be lower after doing exercise for a period of time. And the reason for this is because with each heartbeat, the blood can flow better through your body, so your heart simply doesn't have to work as hard. Aerobic exercise also makes your muscles stronger and able to work longer. So for example, if you exercise on a stationary bike, the main muscles you're going to be using are your thigh muscles. Now, when you first start out, those muscles might become fatigued rather quickly. But after doing exercise consistently, those muscles in the legs will grow stronger, and they will also improve their endurance and be able to pedal longer. Aerobic exercise also helps improve cholesterol levels. It helps lower blood sugar. It can help manage stress and improve self-image. And it, of course, burns calories, so that can help with weight loss. Some additional benefits, as I mentioned, it improves the efficiency of blood flow throughout the body, and it also helps with sleep. So doing exercise might tire you out a little bit, and this can help you fall asleep faster and then stay asleep throughout the night. Now, there's two types of aerobic exercise when it comes to weight bearing versus non-weight bearing. It's ideal to do weight bearing when possible, because what this does is it places positive stress on the bones and it can actually improve bone density. Now, in certain situations, there might be a patient that has a knee injury that they're dealing with. So therefore, a weight bearing aerobic activity would not be ideal for them. So an example of non-weight bearing would be something like swimming, where with the water displacement, you're not putting a pounding on the joints. But when possible and when healthy, it's good to do weight-bearing aerobic exercise to improve that bone density as you age. And aerobic exercise can also help your brain work better. A story that goes along with this is when I was a college student, I would have to study all the time for some of my classes. And after about an hour of studying, I would kind of start feeling a little bit fuzzy. So I would take a break, and oftentimes during my break, I would go and work out a little bit. And I always found that when I came back and resumed my studying, I felt fresher and I felt like I was had a renewed focus. So this brings us to the Fit VP guidelines of aerobic exercise. So we'll go over each section of this. The Fit VP guideline stands for frequency, intensity, type, time, volume, and progression of exercise. So we'll start with talking about the frequency of aerobic exercise. It's ideal for it to be done at least 4 to 6 days per week. So when I work with cardiac rehab patients that come into the gym 3 days per week, I often advise them to take walks on the days that they're not in the gym. So if a patient comes in Monday, Wednesday, and Friday and works out, it's best for them to take a walk on Tuesday or Thursday. When it comes to the intensity of aerobic exercise, it's measured in cardiac rehab with a target heart rate. Target heart rate is defined as how fast your heart should beat while you are exercising. And this range is usually approved by the patient's cardiologist that is overseeing the program. And it's important to be aerobic. What this means is you want to stay in that target heart rate. You don't want to be below it because you're not exercising hard enough then to get the benefits of exercise, but you don't want to be above that target range either because then that can bring safety into question. So the target heart rate, it lets you know if you either need to increase the intensity of exercise or back off. Below on this slide is a picture of just some devices that can measure heart rate while you're exercising. The picture on the top right is a pulse oximeter. That's another way that patients in cardiac rehab can monitor their heart rate. And on the bottom right is an automatic blood pressure cuff. Now, you don't want to use this during exercise, but I just figured I'd include a picture just so everybody could see that an automatic blood pressure cuff, of course, gives you your blood pressure, but it also gives you your resting heart rate as well. And we'll talk more about resting heart rate in a minute here. So there's different ways to determine your target heart rate. Target heart rate during exercise is a very individual statistic. It's different for every patient. So it's ideally between 20 to 60% above your resting heart rate. So your resting heart rate is how fast your heart is beating when you are just relaxing. So the resting heart rate, of course, has to be approved by the cardiologist, and it's usually sent to the cardiologist by a nurse when they take the resting heart rate at the initial interview for cardiac rehab. So this is just an example here of how the target heart rate can be different depending on a patient's resting heart rate. So you can see on the left side, patient number 1 has a resting heart rate of 60 beats per minute. So 20% above 60 would be 72, and 60% above that is 96. So therefore, their aerobic target heart rate range is between 72 to 96 beats per minute. So while they are exercising, the goal is to have their heart to be at the rate between 72 and 96. Then you can see patient number 2 on the right has a different resting heart rate. So that makes it so their target heart rate is a different range. If you don't have a device to measure your heart rate and you want to check your resting heart rate manually, you can look at the picture on the top right of this slide. If you take your index and middle finger and place it on the wrist, just at the base of the thumb, you can count how many times you feel your pulse in a minute, and that is your resting heart rate. And then the last thing to touch on in this slide, target heart rates sometimes aren't what is prescribed by the cardiologist for certain patients. Some patients are just given a ceiling heart rate. So for example, a patient's ceiling heart rate might be 140 beats per minute during exercise. That means you can go up to that, but you can't go beyond it. Another way to measure intensity is with the rating of perceived exertion scale. So in cardiac rehab, what we'll do is we'll show this to a patient either during exercise or immediately after, and we'll ask them how that exercise felt. And we'll ask them to give us a number, and our goal is to get them in the green zone of that chart. So this brings us to different types of aerobic exercise. The good thing about aerobic exercise is there's so many different ways to do it. Now, it's important to make sure you're doing aerobic exercise for at least 10 minutes at a time without stopping. It should be done with a continuous rhythmic motion to elevate that heart rate and then keep it there to improve the strength of the heart and the blood flow throughout the body. And it's also really important to do what you enjoy. If you find that climbing stairs is a good workout for you, but you absolutely hate it, then don't do it. Replace it with something else that you find yourself looking forward to. That's what can help you stay the most consistent with exercise. When it comes to the amount of time you should do aerobic exercise, a good goal is to try to make it so each session is 30 to 45 minutes. Of course, some people can't start out at that. So you can either start out by walking for just 10 minutes at a time. And then if you want to add more aerobic activity to your day, you could do a 10-minute walk twice a day and split it up with breaks in between. So you would just want to make sure that you're going for at least 10 minutes at a time to have the heart rate elevated for those 10 minutes. And you want to always start slow and do more as you improve and as your body gets more used to the exercise. The volume of aerobic exercise is defined by the amount of calories that are burned during the exercise session. A good goal for weight loss and maintaining proper body composition is to try to burn 1,000 calories per week through exercise. And this can be achieved by increasing the amount of days you exercise. You could increase the intensity of your exercise. You could increase the duration. There's many different ways to progress your exercise. And losing weight comes down to the simple formula of calories you take in versus the calories burned. So when it comes to actually progressing aerobic exercise, the rate at which you progress is impacted by a previous level of fitness. So if somebody was in very good shape in the past, and then for one reason or another they got out of shape, they have that experience and they know how to work out, so they might be able to progress faster than somebody that hasn't exercised before in their life. Current health status is of course always a factor, and age is too. So when you want to progress, as I mentioned, you could work on just one component at a time of the FIT principle. So if you're walking 2 days per week, you could add in a third day of walking to increase the frequency. If walking doesn't feel like it's giving you a hard enough workout, you can maybe start trying the elliptical or the bike. And then when it comes to adding time, you could just add just a minute onto each session. And after a couple months of doing that, you'll find that your workouts are much longer than they were previously. So this brings us to the warm-up. Before you do an exercise session, you want to prepare your body correctly. When you do the warm-up, this involves light dynamic stretching. An example of that would be shoulder circles and stuff like that, just moving the joints around, getting some blood flow, loosening them up, and waking up those muscles. By warming up, you slowly increase your heart rate, your blood pressure, and your body temperature. You want those to be a little bit higher during your workout so your body can perform. And this also helps your body and mind prepare for the exercise that is ahead. The good thing about it is that it only takes a couple minutes to do, so it's certainly not something you want to neglect or skip. Then after the exercise session, you have the cool down. So let me just go through an example of why cooling down is very important. So let's say you're doing a workout on the stationary bike and you're pedaling pretty hard. You've been doing workouts on the bike for a while now. You're used to it. You can get your heart rate up. You can get yourself out of breath. Now, let's say you've been pedaling hard for 15 minutes straight. You have a good sweat going. Now, when it's time for that workout to end, you don't just want to stop pedaling and get off the bike and walk away. you want to allow yourself to have a couple minutes, 3 to 5 minutes of very light pedaling. You want to come to a slow stop and come to a low intensity to finish that workout. This will allow your blood pressure to gradually come down. Your heart rate will gradually come down, as well as your breathing. And an analogy I like to use for this is, imagine you're driving your car down the road at 40 miles per hour and you see a red light up ahead. You're not going to keep going 40 miles per hour and then slam on the brakes at the last second. Instead, you're going to come to a gradual stop. So treat exercise the same way. Now, when you do finish that workout and you're off of the bike, it's a great time then to work on some stretching to improve your flexibility. It's good to hold stretches when the muscles are warm, not when they're cold. You always want to stretch when your muscles are warmed up. So by doing these different cool down techniques, it can help you avoid any lightheadedness, dizziness, or any sick feeling to your stomach. And again, it only takes about 10 minutes to do, so you might as well just go ahead and commit to doing a good cool down, especially if you did the whole workout before that. You might as well finish strong. So the main message here is that there's 3 components to every proper workout: the warm-up, the exercise, where you actually make fitness progress, and then the cool down. So something I just want to touch on real quick here is isometric exercise. This is defined as making your muscles tight without moving them. So when you do a bicep curl, you are lengthening and then shortening your muscles. Isometric exercise is when you just are holding your muscles tight. So an example of when isometric muscle contractions are in use is when you're moving furniture, shoveling snow, and holding the shovel full of snow, when you're carrying a laundry basket. And oftentimes in everyday life, when people take these actions, they'll hold their breath and they'll forget to breathe. And what this does is it makes it so the blood pressure and the heart rate and the overall pressure in the chest can increase, which is not good for a cardiac and or pulmonary patient. So you always want to make sure that when you are taking any of these actions, to breathe. You want to exhale. You want to let that breath out to reduce that pressure. And this brings us to strength training. So this is defined as moving resistance using your muscles. It is different than aerobic exercise. It's very important for physical function. And I'll also go through an example of how strength training and aerobic exercise go hand in hand. Some of the benefits of strength training is it makes your muscles stronger and it helps to reduce fat. You burn calories while you are lifting weights. Now, when you are lifting weights, you are doing something to your muscles that is called positive trauma. Now, when this positive trauma is inflicted, you might feel sore the next day from lifting weights. As a result, your body then has to work to repair those muscles from the positive trauma that the weightlifting did. This is a good thing. So when your body is doing this work, your body is burning calories to make those repairs to itself. Therefore, your metabolism speeds up. So your metabolism is the calories you burn while you're resting. So you're burning calories while you're lifting weights, but you're also burning calories at rest when your body is recovering from that workout. So that is how weightlifting can really contribute to fat loss and weight loss in a good way. It also helps with aerobic exercise. So if your primary form of aerobic exercise is riding a stationary bike, if you strengthen your thigh muscles, you're going to be able to pedal harder at a heavier resistance. Therefore, you're going to get a better cardio workout. So you can see how strengthening the legs can give you a better cardio workout. That's how aerobic exercise and strength training go hand in hand. We talked about earlier how the positive stress on bones can make them stronger, which can reduce the risk of osteoporosis and arthritis. Strength training, like we said, it burns calories. It can help reduce blood sugar, and it can help with body changes that come from aging. As you age, you begin to gradually lose muscle, so weightlifting can fight against that. Some additional benefits is that it helps with better balance and coordination. When your legs are stronger, your balance will be better because your legs are your roots into the ground. It also helps everyday activities feel easier, like going up steps. Any athletic hobbies that you have may become easier when you lift weights. Some examples of strength training are free weights, dumbbells, barbells, machine weights are a great way to go. Some other types, resistance bands are great for warming up before you lift free weights. They're also good for just getting a light resistance workout in. Exercise balls, medicine balls, and of course, body weight is always a good way to go too. So the strength training guidelines we give our cardiac rehab patients are to do it 2 to 3 days a week and to always have a rest day in between those weightlifting workouts just to make sure the muscles and joints are rejuvenated. On each exercise, you should do 1 to 3 sets with 8 to 15 reps of each exercise. I like to have my patients go toward 15 reps because what this does is because you're doing more reps, it gets the heart rate up, so it adds a little bit of an aerobic component to it as well. Good form is very important because it keeps you safe from injury and it also allows you to get the most out of the weightlifting workout you're doing. And when strength training or lifting an object, anytime you exert yourself on the lift, you want to make sure you exhale again to reduce any pressure that is built up in the chest. So this brings us to some guidelines for exercising in warm weather. So during the summer season, if you enjoy exercising outside, you should try to avoid exercise if it is 85 degrees Fahrenheit or hotter outside. People that have diabetes, peripheral artery disease, and heart failure can be at risk for overheating during the summer. You also want to be careful of high humidity. If you do want to exercise outdoors, you should aim to exercise early in the morning or in the evening when the sun is lower in the sky. Make it a shorter session than usual. It's also important to not be stubborn. So if every summer morning you take a walk at 9 a.m., it's probably lower than 85 degrees out at that time, so you're probably okay. But let's say during a heat wave in the summer, it's already 90 degrees at 9 a.m. Don't be stubborn. Cancel the workout last second. It's better safe than sorry. Maybe find a different workout indoors. Just be open to changing plans last second if the weather isn't ideal for exercising. Some additional guidelines for warm weather exercise. You want to, of course, stay hydrated. The best way to stay hydrated is to keep water near you all day. You'll find yourself reaching for it and sipping it throughout the day. If you do work out outdoors, do less exercise for shorter periods of time. Plan to take frequent rests, exercise in the shade if possible. Do a longer cool down because your heart rate will probably be higher than usual if you're exercising in the heat. And also wear the appropriate clothing with good ventilation. When it comes to cold weather, you want to exercise indoors if the temperature outside is lower than 35 degrees Fahrenheit. Cold air can make your heart work harder because the blood vessels in your arms and legs are constricted. So when they are constricted, your heart is going to have to beat and work harder to send blood to those working parts. Anybody that has coronary artery disease and is over the age of 60 can be at risk for hypothermia. This can make it so organs don't function properly. You want to be careful of wind chill. You do want to do a longer warm up if you're outside on a cold day. You want to make sure the joints and muscles are extra warm before you start to exercise them in the cold. And you, of course, want to dress appropriate. So these are just some quick guidelines of overtraining and overexertion. So this whole presentation, we've talked about the importance of doing exercise, and it is very important, but you also want to make sure that you get proper rest in between workouts. So some signs of overtraining that you might want to look out for is an inability to relax. Maybe you find that you just can't stop. You just keep doing stuff and you just feel irritable. Maybe you're in a bad mood more than usual. This could be a sign that you're actually overtrained. Another one is being excessively tired after a workout. So if after a normal workout, you're a little tired, that's normal. But if you are just extremely tired after a workout that usually doesn't get you that tired, then it might mean that it's time to take a couple rest days and let your body recharge a little bit. If you lift weights and then you have muscle pain and joint pain that lasts for days at a time, that could be a sign that you might need to lift a little bit lighter and do a little less volume of weightlifting, less sets and less reps. When it comes to overexertion during exercise, if you experience chest pain, pressure, tightness, squeezing, or discomfort, you should use the nitroglycerin that you are prescribed and call 911. So we'll just finish up now with some tips on general wellness. It's important to choose exercise that you enjoy. You want to find yourself looking forward to exercise. This will help you stay consistent. Consistency is the most important thing when it comes to being healthy and being in good shape. Every workout doesn't have to be a great workout. You're going to have some workouts that don't feel so good, and you're going to have workouts that feel great. But as long as you just show up and do it, you elevate that heart rate, you work the muscles some, then you are going to be in good shape and you're going to be a healthier person with that consistency. Just some safety tips. It's important to walk slower when going uphill and downhill. Always make sure that you're in a safe, comfortable environment when you're exercising, because you always want to avoid injury. The fastest way to ruin fitness is with an injury. So you always want to make sure that you're safe and you always want to be aware of your surroundings. The best time to exercise is 30 to 60 minutes after eating. If you have a larger meal, just make sure that you wait long enough for all the food to be digested. If you are a tobacco user, you should try to avoid using it at least 4 hours before exercising, because this can make your heart have to work harder because those blood vessels will be constricted during the exercise. And wear the proper footwear. If you're going to be walking a mile or two, make sure you have a good pair of sneakers on and they're tied tight. Don't do it in thin-soled flip-flops. Now, if you do walk, say 5-6 days a week, and you use the same sneakers every time, they're probably worn out after about 3 to 5 months. Even if they still might appear to be new, the cushioning can lose its integrity and its support in a sneaker after just 3 to 5 months of use. So just be open to getting new sneakers on a regular basis if you walk and exercise in the same sneakers multiple days per week. You might as well be good to your feet because they take you everywhere you go. Just the last few tips here. You, of course, want to get plenty of sleep. You should aim for 7 to 9 hours. Lack of sleep will make it so exercise feels more difficult. Nothing feels as good when you're tired doing it, and this can lead to inconsistency. Stay hydrated, drink water before, during, and after your exercise, and try to avoid caffeine before exercise, because caffeine raises your resting heart rate and blood pressure. So then when you start to exercise, your resting heart rate and blood pressure are going to be even higher. Excessive caffeine intake can cause irregular heartbeats, and it also makes it so your body will have to work harder to cool itself down during exercise. Caffeine can also make you lose water, which can lead to dehydration. So if you do have caffeine, just make sure you're taking in water as well. And that is everything I have for you all today. Thank you very much for listening.
Thank you, Andrew, so much. We truly appreciate it.